Good morning, everybody. We're just going to hang on for one more minute until the official opening of this first COVID-19 research morning of the Smurfit School of Business. So just bear with us for another minute or so until everybody has. Thank you.
So we can see the participants are joining now. So we'll just leave it another 20 or 30 seconds while they're logging in, okay?
Okay, there's 32 people actually online, plus obviously our panelists, which is wonderful. Hello, everybody. I'm absolutely delighted that you have this opportunity to join us for what is the first of two showcase mornings displaying the breadth and relevance of the research that is being done in UCD Business School at the moment on COVID-19 and pandemic issues. Not going to have to tell you that all of this has caught us completely unawares, but I think these two mornings and the response that I got when I proposed these mornings just showcase the responsiveness of our researchers, the resilience of the researchers that we have in UCD Business School, and the relevance of our business school research. I'm particularly delighted that I've got respondents from across and presenters from across all 6 subject areas. So again, just witnessing the breadth of research that we have in the business school. I'm not going to say anything more because we have a packed morning, 6 presenters, and starting us off is Julie Shiro and Lauren Min with a topic on social distancing and mask wearing in response to COVID-19. How conflicting physical and social threats compete to influence behavior. Julie, over to you. Thank you.
Thank you so much, Susie, and thanks so much for organizing this session. So what we're looking at is this tension between social well-being and physical well-being. And this is joint work with Dr. Lauren Min. She's at the University of Kansas. And as most projects do, this started with our own personal experience. So here is both of us back in March. This was very early March. We were actually both traveling to the SCP conference in Huntington Beach, and we were both the only ones on our flight wearing a mask at that time. And as you can imagine, that was quite awkward, especially when the masks looked like this. You can see I'm trying to make it cute. I have a bow in my hair, but that didn't really help. I got a lot of dirty looks and it was very uncomfortable, which got us thinking about how people make the trade-off between social well-being and physical well-being. So we looked to the literature to help us understand what had been done. And there's a lot of models of behavior in the kind of protective action realm. So in all of these models, which are kind of the top models used according to this review, so these are kind of across the literature, the ones that are used most often in predicting whether you take a protective action like wearing a face mask. And they all had components for kind of physical and social well-being, such that all of these models would predict that, the more afraid you are of the physical threats, the more likely you are to take the protective action. And the higher the social cost, the less likely you are to take the protective action. But the problem is that they didn't really talk about what's going to happen when these two are opposed. And actually, that doesn't really happen very much. It's really with COVID-19 that we're seeing it play out in such a drastic way that there is kind of this tension forming. But the fact is that these models don't make any predictions about which one is going to override the other, the relative strength of one or the other. Now, if we look at, classic psychology, Maslow's hierarchy of needs, we could get some insight there. So the base of the pyramid in terms of what needs people prioritize, it's physical safety supposedly comes first, and social is higher up the pyramid here. But the interesting thing is when you look at the literature that's actually studied, social versus physical well-being in the context of things like smoking and drinking, often we find that social well-being kind of takes center stage. So this study, they looked at a bunch of different real public service announcements in all of these different kind of message types. And what they found is that the most effective messagings were ones that highlighted the social costs of smoking. And that was the most powerful predictive path in this model, more so than even kind of the physical risk factors, vulnerability, and threat. Now, this was conducted with adolescents, and you find this again and again with adolescents, that they're a lot more sensitive to social costs, which doesn't really, that's not really shocking. If you look at how age plays into this, typically the social cost loses influence as people age. But there's not been a lot of research on this question, on comparing these two anyways. And what's more, there's a lot of issues with what's been done just in terms of kind of what we can take away and apply to this situation. So specifically in terms of the limitations, there's a bunch of different confounds that we see emerging. One is this idea of a confound on threat severity. So typically, comparisons that have been studied for, say, smoking would be, the social one would be, bad breath or yellow teeth. And the physical would be, getting cancer. And clearly those two are not equated on severity. With COVID-19, you're never going to get them perfectly equated, but it's a lot more equal. I think it's fair to say that the social costs of social distancing and having to wear a mask all the time and being away from family and friends is a lot more severe, and it's a lot more visceral and felt. Confound on timelines, typically, again, these physical versus social factors evolve over different timelines. The social one evolves kind of immediately or right away. If you think about drug use and the effect that has on social groups, that happens basically as you start using drugs, but some of the more physical components, the physical consequences, happen much later. So again, it's difficult to say what's having the influence. Is it the physical versus social, or is it the difference in timelines? Again, in the context of COVID-19, because both consequences happen in a very short time scale, that allows us to really mitigate that confound. And then we have a confound on vulnerability. So what you see again and again is that, especially when looking at adolescents, they agree that, yes, getting cancer is really severe. The threat is there, but I'm not going to get it. Now with COVID and based on our testing as well, people don't really think this way. People are saying, yes, I am vulnerable to getting COVID and I'm, afraid of it. So the last confound is that no studies that we've seen so far have asked people to make a trade-off. So in this one paper, they did look at physical and social at the same time, but they both went in the same direction. So you didn't have to choose to prioritize one or the other. They both were aligned. So taking the protective action gave you a physical benefit and a social benefit. But what we want to know is how people are approaching these two when they conflict. So for example, wearing a mask and getting dirty looks protects you from the virus, but doesn't help you so much on your social well-being. So what we did is, this is a study we ran in early May. It was a cross-national survey across the US, Ireland, and the UK. So we had 900 participants. And we asked them, how likely are you to wear a mask? So this was kind of before all the mandates and before it was a lot more of a kind of common and expected issue. And then we asked them about, how scared they were of the virus, the physical risk, and we asked them about the social factor. So how judged they would feel if they wore a face mask. And what we're trying to determine is the relative importance of each of those factors, protecting against kind of the physical components, the extent to which vulnerability and physical threat influence behavior versus social threats. And what we found is that there isn't a single answer. In fact, there's an interaction between these two factors. At the really high level of threat, so that would be a physical risk of, say, 7, I'm super scared of the virus. And over here on the y-axis, we have propensity to wear a mask. What you see is that whether or not it's socially okay doesn't seem to matter much. So that's a non-significant slope, as is this one. So when physical risk is 6 or 7, not too concerned about whether it's socially okay or not. And this makes sense. But as you go down on physical risk, so once you hit physical risk of 5, now all of a sudden, whether or not it's socially okay starts to really influence my behavior. And it only gets stronger the less scared I am about the physical risks. So all of these slopes here are significant. So the less socially okay it is, brings down my propensity to wear a mask. Now, the other interesting thing is that we didn't find a triple interaction with age. So past research has shown that age, as people age, they become less sensitive to social risk. We're not actually finding that in our data. And we also found that this held across all of the countries. So I know that I'm running out of time here, so we can talk more about this in the questions, but our next follow-up was to do an experiment where we manipulated these constructs because, before that's all correlational, we want to establish causation. And so what we did is we manipulated the social risk and the physical risk, and that's what we're working on now. Now, I know I'm out of time. I promised I would keep this to 10 minutes, so I'll stop there and we can talk in the questions if there are any about kind of how that worked out for us. So thank you very much.
Fantastic. Thank you so much, Julie. And Julie in the marketing subject area, we have Julie down as our queen of the whole sort of Zoom universe, and you can see why. Very professional. Thank you so much, Julie. Do we have any questions for Julie and the very interesting issue that we're all obviously experiencing every day of mask wearing?
I have one.
Okay.
Please.
Yes.
I might have missed that, Julie. It was too quick maybe for me, but the experience in mask wearing they have, so the extent to which they might have spent time in Beijing, Shanghai, Hong Kong, because I mean, some regions of the world, they have been wearing masks quite frequently, and it's pretty normal to do that when you have a cold. Or, I mean, now it's normal everywhere, but it used to be pretty normal there. To what extent do you cover that?
Yeah, no, it's a great question. And the answer is we haven't covered that yet. And I completely agree. So when we were deciding kind of where to run the study, we specifically chose countries where at the time it wasn't socially acceptable. So we would get totally different results if we ran this in, say, Hong Kong or in China, where there's not that social stigma attached to wearing a mask, the same way that it was. I would say it's getting much better now, which is why we've moved into kind of social distancing. But it's a really great point, and you're right that it hinges on it being a social cost. And what we found in our data when we collected in early May was that it was seen as a social cost. Thanks for the question.
Any more questions for Julie?
I would have a follow-up question, if I can.
Sure.
Sorry, Andreas, we'll just let Effe come in here with a question.
Yeah, sure.
Effe? I'm not sure if Effe
Okay, sorry, I can see it here. Sorry. Thank you, Effie.
So the question is, could you also share the results of the 2x2 study where you manipulate the variables, or is it currently a planned study?
No, we did run it. We actually ran 2 of them, and I'll just show you just very, very, very quickly. Actually, Susie, do you want me to wait on answering this, or do I have a minute to go into this?
You have a minute, absolutely, yes.
Okay, perfect. So Effie, to answer your question, what we did is we manipulated social acceptability through an imagined scenario, specifically a Halloween party. This is the low social risk where we have this made up chat. So the premise is that you're getting invited by Ben and Kristen to a Halloween party. It's all indoors, and but they're very understanding about you not coming because of COVID, or they are not understanding. So we have in the high social risk, we have Kristen and Ben are very clearly not into COVID-19, and there's kind of no information here about them being okay about, you know, you're not going. So we also manipulated physical risk. So we essentially asked people to imagine that they're highly vulnerable or not. And here is what we found. So if we were going to replicate what we found before, we would expect not really any difference in the high physical, and that's not a significant difference, but we would expect a large difference in the low physical condition. Now, the interaction was significant, but it was significant in the wrong direction, which was so confusing to us. So we would expect that when social risk is high, and by the way, the higher the number here, the more likely you are to say, yes, I'm going to go to the party. Actually, when social risk was high, they were a lot less likely to say they'd go than when social risk was low. And we spent a lot of time trying to figure out why this was. It turns out that when people see this invitation with Kristen and Ben, it turns out that they don't like Kristen and Ben anymore. So anyway, we need to fix that in the next study.
Great, fantastic. We have two hands up for questions, Geraldine and Orla.
Yes, so thank you, Geraldine. So the question is, it might be interesting to perform the study again, given the changes in mask wearing. Absolutely, I agree. And I think that what we'd see is that the social stigma will really have dropped across all three countries. And so it won't be so much of an issue anymore. Although I would expect potentially in the United States an interaction with political ideology, just kind of based on the rhetoric that has evolved over the last couple of months. So I think that that would be really interesting to explore as well.
And then we have one more question from Orla, I think.
Hi, yeah, thanks, Susie and Julie. Great study. I was wondering, could you tell me about the study responses? So you got 900 responses. How could you tell us? Share a secret.
What's the secret sauce?
Yeah, exactly.
So the sample came from Prolific. So Prolific is similar to MTurk, if you know about MTurk, but I found that, well, I'm really enjoying using Prolific because it's kind of a more untapped sample, and it allows you to collect people from all over the world. So we can easily specify we want people from the US, UK, and Ireland, but we could have easily specified other places as well. So you just pay them based on how long the study takes. I think for that study, it took like 3 minutes. Yeah, we can talk more too. If you want to send me an email, I can share some of my secrets.
Great, thanks, Julie.
Perfect, and perfect timing as well. Thank you so much, Julie and Lauren, for this really interesting presentation to kick us off. Andreas, I'm aware you didn't get your second question in, but you're presenting now, which I'm very much looking forward to your presentation and Janan's. So it's Andreas Höppner, Markus Leipold, Janan Lin, and Andrew Vivian on COVID-19's effective reproduction rate, the famous R, across 178 countries. Which containment measures actually work well? I think that's the sort of the $1 million zillion question at the moment. So over to you, Andreas.
Thank you very much, Susie. I might email Julie the question because we're also looking at mask use. So we as one of our variables, so we would find that very interesting to discuss more. I hope you can see my screen now. Yes, I only do very simple color coding here. Can you see it?
Yes.
Susie, maybe some feedback. I can see my screen. Okay, perfect. So it's a few countries less by now because we've decided to do a slightly different imputation technique. So we impute some of the control variables with means to neutralize them, but we do not impute any of the non-pharmaceutical interventions. So we're following a paper that was published literally 10 days ago, literally Saturday, 2 weekends ago. And sorry, that would, yeah, pretty much. So it'd be 13 days to be precise by now. And is published in Lancet, looks at the non-pharmaceutical interventions, but has no control variables and relatively limited data. And most importantly, they don't study the real effective infection rate. So the effective R is effective reproduction rate that you see the daily numbers that you can observe, all of us, simply the log return of that. They just study smoothed rates, which are barely changing, 1.4, 1.4, 1.5. So we are studying the real rates. We've been doing this now for 4 months. By now, we are pretty sure we have tamed the data. Since it's a very quick presentation, I mean, it's pretty obvious why to study that. In finance, there's a lot of work relating this to, say, central bank responses. We've published a paper there in environmental and resource economics ourselves, financial markets, mutual fund flows, and other aspects. Then some studies early on were trying to get the basic reproduction rate. So that's simply how infectious is the virus regardless of what you're doing. The effective reproduction rate is what you're doing, is it actually helping? So which interventions are helping and which other factors are impacting it. The study that we're following, just published in Lancet Infectious Diseases, takes non-pharmaceutical interventions from the Oxford data, that's the same data that we have as well, and looks at 131 countries until July 20th, but they don't have any country control characteristics. They don't control for things like weekdays. COVID rates tend to be higher towards the end of the week because there was better reporting, if you want. So Mondays, Tuesdays, they're a bit lower because over the weekend, doctors don't work. And most importantly, they also don't look at the disease itself. So of course, it's infectious. So if there is a general trend in the disease, whatever intervention you put in on that day will most likely, first of all, just capture the actual trend. So for instance, if you are closing down any public events on an upwards trend, quite likely the first couple of days, you're going to, first of all, see that upwards trend in the real data. In smooth data, that may be different. Some psychologists from the University of Maryland study a similar aspect with somewhat different econometrics and a rather low degree of freedom as well, just to mention that. Otherwise, we haven't found anything in the public literature to date. So we're looking at the COVID rates across 163 countries, and we're looking at the non-pharmaceutical interventions. That is, for instance, mask use, but a whole range of other factors as well. We're looking at pandemic aspects. We're looking at demographic aspects. We're looking at health aspects, political aspects, economic and econometric. In the interest of time, I'll explain them within the actual results. So there are data concerns, obviously. So first data concern was simply that countries that have more healthcare financing are better actual report aspects. Health expenditure per capita is used as a control variable. Then there's also the concern, if you're studying 160 odd countries, that simply politically very restricted countries just report less. So the press freedom index is a variable that we also include. Furthermore, it is quite important to understand if the start date, so the pandemic of course had different start dates, and we're defining the 1 in a million cases per capita as a start date. If that has an influence, we have found that as soon as the sample runs until end of June, the start date doesn't have an influence anymore on the pandemic. Our sample at the moment is extremely up to date. We're running until October 31st, so until Halloween. And we'll present it actually later today in Zurich too. And we're essentially using pooled OLS regressions with region dummies as needed. It's a locked normal regression because our dependent variable is locked. So I'll skip these slides. We can come in by ask, but to go straight the actual model and then to explain the variables. So our models run from no lag dependent variables, so we're not at all looking at the infectious nature of the disease on itself, to up to a week of lag dependent variables. And as you can see here, there is significance for up to 5 weekdays on the actual on the rates themselves. And so the actual days that you report, if you want so, do impact the rates the next day with the actual collection process. In terms of explanatory power, we come up to 22%. And then in terms of weekdays, we show that pretty much towards the end of the week, cases tend to go up because there was basically more time to go to the doctor, get a test, report them. So Thursday and Friday numbers tend to be higher, Wednesday numbers as well, than say Monday or Tuesday numbers. Then looking at the actual key question, what actually drives the pandemic? So, and you can interpret our results as what drives them as well as what doesn't drive them. So unfortunately, there is a rebound effect. So, and that's probably psychologically, when 7 days in a row, the R is below 1, so when the panic is off people, that tends to increase the actual R rate. So we need to not rest at some point. We need to really win against the pandemic. At the moment, we tend to rest when it gets too easy. We may go out more, we may party more and so forth. Having experience in mask use is actually very useful. So those countries where there is mask use as a tradition, that certainly helps. The start date has no influence, so our sample is not biased. Being exposed to SARS, we are talking to medical co-authors to potentially join us. They were quite keen to know if the SARS exposure makes a difference. That actually is not the case. At least we don't find any significant effect. Contract tracing also much less important than it's said in the media. Then when we look at demographic variables, so the age variables don't come through. They came through in earlier samples. So if you cut down in June or May, age does come through. If you don't, it doesn't come through anymore. The population density is key. So if there's a denser population, obviously there's more infections. That actually increases, the R rate increases COVID, if you want so. So health expenditure per capita has a quite significant downwards effect. So basically better health systems seem to be able to better deal with COVID. That also means we don't have a data bias here. As we already know, obesity in the vast majority of specifications, the odd specification are the ones where we don't have regional dummies, is actually contributing to more. We do also find that, as you may expect, some countries are not honestly reporting. So the more restrictions on press freedom, the lower your R rate, which is most likely simply wrong. But so that needs to be controlled for and is controlled for here. Now the first finding, which is most likely true, but a bit hard to swallow, the more unemployment, the less you infect each other. So if people don't actually have working pressures, they're more unemployed, they don't necessarily move that much, that actually seems to reduce, and throughout all the models, effectively infection. And then also pretty much expected, the more airports you have, so the more you actually travel or can travel, the more you get infections. Now coming to the actual key variables, all the measures that are basically imposed on us. And I do need to highlight that this particular table has multicollinearity concerns, so they're interacting with each other. We'll have a table following which clears that out, effectively clears the field. But you can already see that closing public transport, canceling public events, testing policy, restrictions on internal movements, public information campaign don't come out that strong. What comes out extremely strong, you see that later as well, is to basically take pressure off people. So actually income support and debt and contract relief. So make them not have to worry that much about the economic situation. That helps them to protect their health. I've shown this before. So we have the respective weekday dummies controlled and a relatively strong model. And the pattern is that you get higher rates, understandably, on Thursday, on Friday, when there's more time for the system to essentially report. And now looking at the non-pharmaceutical interventions without—
1 minute left.
Yeah, I'm also done. Looking at the non-pharmaceutical interventions without multicollinearity controls, you can essentially see what works strongest. Those that we highlight in green are consistently actually working in reducing COVID. We have ordered them on the conclusion slide. Strongest in our research so far is debt and contract relief. Second strongest, income support. Facial coverings are third. International travel control will be fourth. If you do by significance first and then by effect size. Restrictions on internal movement, fifth, and school closure, which is probably the hardest to swallow, would be six. In addition to this, mask use is helpful and the experience in it. Unemployment and health expenditure also help to actually contain the virus. The virus is driven by the number of paved airports, population density, and obesity. That's us. Thank you very much. I hope I was spot on time. And that's it.
You were spot on time, Andreas. And could I ask you to actually leave the last slide up that you had there, because there's a lot to digest in your presentation, and I think we're all super interested, obviously, in the results that you're presenting. We already have a first question from Donna. Donna wants to know, is contact tracing not as useful in keeping the R rate down due to different contact tracing systems? For example, the UK is doing contact tracing, but are only reaching about 20% of contacts.
So, of course, we can only look at which countries have contact tracing systems, not how good they are. That may be a study for later. If you had countries that had very good contact tracing systems, from my personal reading of contact tracing systems across a range of countries, that includes Germany as well, the willingness of people to participate and then the actual follow-up is not as strong and not as timely as people would have hoped originally. So contact tracing was presented as a way that people can pretty much move freely as long as everything is traceable. But at these numbers, we're looking at hundreds of thousands globally, tens of thousands in most larger countries daily. It's simply, I believe, not feasible. So if we only looked at contract tracing in the first couple of days, or maybe looked at purely Iceland or something, or South Korea, that could work. But we're looking at 163 countries, so contract tracing has no effect across the average country, if you want so.
It's really, really interesting, actually. Are there any other questions? You put them into the Q&A, that's the easiest for me to see them. Okay, if I could ask a question, actually, Andreas, I'm just fascinated by the fact that the economic variables come out so strongly. Your medical colleagues whom you're talking to, were they surprised about that? Have you had any sort of interactions with, politicians, medical staff, and anyone who can actually put this into their own sort of more medically driven experience? So
we were all initially somewhat surprised. The longer we're discussing it internally, it's effectively two themes that are coming up. Stop people from meeting each other and stop people from infecting each other. Meeting, yes, but with masks. And then stop people from cheating on the rules. And essentially the economic is effectively, the more economic pressure is taken off people, the less likely they're actually cheating on the rules, the less pressure they have to just do things. Because obviously, given that anyone, literally any citizen currently is a potential suspect of infecting you with COVID, it is completely impossible to effectively enforce any of these things because you can't monitor anyone at any point in time. And in that sense, because you can't enforce many of these rules, you have to incentivize them. And the best incentive is to take essentially the disincentives away.
That makes complete sense, yeah. Really interesting. Any other questions for Andreas? Okay, very rich presentation. Again, a lot to digest, Andreas. Just, hopefully you can keeping the numbers so current as well as we go through this lockdown, international second lockdown period. So thank you so much for the presentation, Jan, as well for your work. And I'm going to hand over the floor to Niamh Brennan and Sean Power, who are presenting on behalf of their co-author Victoria Edgar as well, and who are going to talk to us about COVID-19 profit warnings, how to deliver bad news in a time of crisis. So Sean and Niamh, over to you. Thank you.
Maybe briefly do it, Susie.
Yeah.
Medical colleagues say we have to actually do this. Medical journals require us, if we submit, to give them updates every 2 months. So very different to management journals.
Yes, yes. Thank you, Andreas.
Thank you.
Thanks. I'll just share my screen quickly. Can you see the slides at the moment?
Yes.
Great. Okay, this presentation provides a brief overview of a project that I worked on during the summer with Niamh Brennan and Victoria Edgar at University of Agder. The paper is titled COVID-19 Profit Warnings, Delivering Bad News in a Time of Crisis. Our paper examines how companies deliver bad news during a time of crisis. As COVID swept across the globe at the beginning of the year, it caused extreme uncertainty and an intense crisis for societies and businesses. Under stock exchange rules, companies are required to disclose material negative news immediately, and these announcements are termed profit warnings. Profit warnings are interesting artifacts to study because relative to, say, annual reports, they tend to contain much more forward-looking information, And due to their immediacy, they contain less boilerplate disclosures and the use of more emotional language. The outbreak of COVID created a unique once in 100 years context to study profit warnings, because as the pandemic created an exogenous shock to the economy, you have very large numbers of companies releasing profit warnings within a very short time frame. Our paper specifically looks at London Stock Exchange listed companies and their release of profit warnings between the months of January and April of this year. We addressed 3 research questions. First, what is the disclosure quality of profit warnings? Second, what factors influence profit warning disclosure quality? And third, is there evidence of silence in profit warnings? To address these research questions, we develop an analytical framework or a typology to assess the quality of profit warnings. There are 2 components in our typology. The first one is the quality characteristics of profit warnings. Underneath this, there are 4 subcomponents, which include forecast specificity, the number of assumptions that are included within the profit warning, whether management discuss remedial actions that they intend to take in response to the crisis, and fourth, the prominence of profit warnings. In other words, at what point does it become apparent that the document is in fact a profit warning? Is it in the title? Is it in the beginning of the document, the middle, or the end of the document? The second component of our typology is the quality of supporting disclosures in profit warnings. And there are 9 subcomponents underneath this. Whether the company discloses its liquidity position, borrowings, current credit lines, the resource needs of the company, whether it discusses government stimulus money, and whether it discusses or discloses the impact of the pandemic on its revenues, its operating costs, dividends, and capital expenditure. We manually analyze the content of profit warnings against this typology, and this allows us to calculate a disclosure quality score. This is a proportion or a percentage, and it's a multi-dimensional measure of the disclosure quality of profit warnings. We then test a model of factors that affect disclosure quality using least squares regression. In terms of our data collection, we searched the London Stock Exchange website between the months of January and April of this year for trading updates that include the terms SARS, Corona, and COVID. This resulted in a collection of 428 trading updates. We then looked at other sources such as the Financial Times, Twitter, etc., and added a further 23 profit warnings, giving us a very large collection of 415 trading updates. Among these 451 trading updates, we identified 160 profit warning documents and 164 profit warnings within these documents through manual analysis. When you look at the timing of the profit warnings, we didn't have any profit warnings released in January within our sample. There are only 6 released in February, and from March onwards, the floodgates open. We have 75 in March and 83 being released in April, giving us our total sample of 164 profit warnings. When we manually assess the content of these 164 profit warnings against our typology, we find first that there is very low disclosure quality. Our metric disclosure quality score, the mean of this metric is very low. It's only 27.95%, obviously of a possible maximum of 100%. This indicates very low disclosure quality among these 164 profit warnings. Second, we find evidence of firms regressing to silence. When we look at the inclusion of forward-looking statements, we find that 51% of firms regress to silence in one form or another, whether that's not providing a forecast, a disclaimer of forecast, or simply reaffirming prior guidance. When we regress firm characteristics against our metric of disclosure quality, surprisingly, we find that firm characteristics such as size, gearing, and industry are not significant within our model, but the market that a firm is listed on is significant. Larger firms listed on the main market have significantly higher disclosure quality relative to smaller firms listed on the AIM market. We also find that the time period after the Financial Reporting Council issues specific guidance on the content of profit warnings is significant within the model. The FRC issued this guidance towards the end of March, and our model shows us that profit warnings released after this guidance is published are significantly associated with higher disclosure quality relative to profit warnings released before this guidance is published. So overall, our conclusions are recommendations to policymakers, which try to enhance the quality of profit warnings. First, it's very difficult to find profit warnings on the London Stock Exchange's website. Companies tend to publish these documents under a variety of different categories, and it makes it very difficult to find, and in addition to identify what is a profit warning and what is not. If the London Stock Exchange created a specific category for profit warnings and companies were required to release these documents under that category, it would make them much easier to find. Second, our study finds evidence of very low disclosure quality in our sample of profit warnings. And at the moment, the regulation or guidance on the content of profit warnings is largely unregulated. If there was more specific regulated guidance on the content of profit warnings, this would hopefully improve disclosure quality and reduce information asymmetry between firms in the market during times of crisis. And that was a brief summary, maybe a bit too quick, but of the project and the paper that we were working on during the summer. Thank you.
Fantastic, impeccable timing. Thank you so much, Sean and Niamh. Any questions for Sean? Okay, everybody's still thinking, so I'm going to kick you off if I may. Sean, it's really interesting to see, just how, and probably not a surprise to you guys because you've been studying this space for so long, but just, I suppose, the lengths to which companies go to hide bad news. In terms of the regulations, I'm assuming they're all still playing, by and with around the regulations. Has there been any developments in this space due to COVID? So your data is from March and April, most of it. In the meantime, has there been any move from the regulators or from the London Stock Exchange, for instance, to make these profit warnings a little bit more visible for investors?
So during the pandemic, there were, in March 2020, they released specific guidelines. The FRC released that, and also the FCA, FRC, and the Prudential Regulation Authority issued a joint statement in March during the pandemic. And that affected, obviously, our sample in the time period we're looking at, but there was additional guidance published in May by the FRC, and that added further points and further guidance to that regulate the content of these profit warnings. So they are responding, with the documents in March and May.
Not surprising. Any further questions? Okay, in that case, I would recommend if you have any questions to Sean and Neve, maybe you can send them an email. Again, there's a lot to digest, and I'm aware that we're sort of moving from one really rich presentation to another very quickly. So please don't hesitate to send your questions to the presenters directly if you have. We're moving on swiftly to yet another super interesting presentation by Antonio Vico, Dimitar Krastev, Martin Lind, Sean Coleman, Rachel Burke, and Ken Hessian on the evolution of COVID-19 national strategies, a comparative study across 5 nations. Antonio, I'll hand over to you.
Okay, thank you so much for organizing this. And I'll try to be very quick as well with my presentation. So the initial motivation behind this research is the surprise that maybe a lot of us had during these few months of how different countries have developed completely different strategies, especially when we think about countries like Sweden. Sweden has had a very different strategy regarding COVID to other countries, where in Sweden there has been no lockdown whatsoever. There's no recommendation of wearing a face mask is not compulsory either. So all these made us think, what explains that you have different nations more or less looking at the same data in terms of COVID, but still they come up with radically different strategies. So that was our kind of initial intention behind this research. So what we do here in this research, and we only started recently on this, so we don't have a lot of results at the moment. Sorry, hold on a second. Oh, yeah, sorry. So our theoretical background is, from where coming from, is from this idea that people's schemas, okay, actually are going to be connected to the strategy of the country. So the schemas of those in each nation, in each country, those schemas of those mental schemas are going to be connected to the strategy of the country. So a good way of trying to understand how a strategy has evolved, a change over time, is by analyzing, looking at those mental schemas. And a way to do that, a good way to access mental schemas, is by looking at the written communication, looking at what people actually say, looking at the language, looking at how they actually say and communicate their strategy. We have a paper there as an example of the kind of theoretical background we use. And in a way, this is similar to what we are doing. In this case, this paper that you have there, Measuring Up, what they do is there is an external event, in this case, a new technology in the telephone industry. And what they do is they look at 2 different firms and see how both react differently and how they both create strategies by just, even though they are looking, or they are presented with the same kind of technology. So in a way, it's the same thing we're trying to do here. We're trying to look at these 5 nations, these 5 countries. They're facing the same event. They more or less have access to the same data, when in theory they should, but they come up with completely different strategies. So our idea is to look at the written communication from the beginning of the crisis until now. So the data come from there, and what is the data we're looking for? We're looking at all official government communication from Ireland, the UK, Sweden, the US, and New Zealand. We probably want to expand the countries to another, to other countries, to include Spain as well. But at the moment, we're looking at these 5. And so we've been basically downloading all the press conferences, press releases related to COVID that are official. As well, we've been looking at media interviews. So basically any text that can actually give us an indication of what rationale, what logic decision makers are using to create or to build strategies. So we've been downloading quite a lot of data, and we've been doing, so we've been getting a lot of the format, most of the format was in video. So we've been doing a lot of transcribing that into document, into text. And then our methods, what we want to do, and we have started doing, is 2 things. The first one, we're doing manual coding. So we see this as an explorative research. So we want to read, and we want to code, we want to identify themes and see what are the main reasons, the main rationale that they are using by reading these documents, okay? But now, even though it's quite explorative, our approach, we're kind of bringing, just to narrow things down a bit, we're bringing these public health principles. So the knowledge of the infectious status, how much reasons around that area, or to what level different countries are using these reasons to create their strategy. Or community engagement, okay? How much are they engaging with the community? How much of co-production of a strategy we see in these texts? So for example, we already see quite a lot of difference between New Zealand and Ireland or the UK. New Zealand seems to be very, very focused on this, on engaging the community very actively. So you already can see there's some differences in there that might affect how your strategy is built, because obviously the more stakeholders you involve in the co-production of your strategy, the more differences you're going to find. Okay, so we have more public health principles there, like engaging with other external authorities. So to what level are you engaging with European Union, if you're in Europe, with WHO, with other countries? Because as well, that's part of co-production of the strategy, and that's going to explain differences in the strategy, how it's been built. And then as well, public health capacity. We're talking about different countries with different levels of public health capacity. So how are decision makers using rational logics, reasons within this area to build their strategies? Now, the last point we're using for our manual coding as well is something that I probably bring from my background in moral philosophy, and is ethics. We have the intuition that a lot of the differences in strategy are not so much due to the actual data, but that there is a moral component to it. When you're trying to make a decision about whether to enter a lockdown or not, there's a lot of moral considerations to take into consideration. So we want to look at that. Is there a very different moral language behind the text we're looking at? Is the moral assumptions used in Sweden to justify not going to lockdown very different from the ones used in Ireland? So we think that we already can see quite a lot of difference, and we are looking at these two main moral philosophy approach. One is utilitarianism, that basically focus on consequences of your actions, and the ontological approaches that look more at rights, moral laws, and elements like that. So we want to see whether there is a difference. So at the moment we're doing quite a lot of coding. I think we're almost done with collecting the data, or the data we're looking for. And now after that, we want to use the themes we identify with this coding. We want to use it to run computer-aided text analysis. So we'll identify themes, and then we'll start to look at, what are the regularities, and what are to get some data around these themes that we have identified. So far, we've done some preliminary analysis, computer-based analysis, but it's very simple. This is just to get an idea what we can find in there. So what you have in there is for Ireland, I think. So we're looking, for example, at, how much they talk about public support and the presence of public support themes through the different months, and the ratio as well. So how relevant is to the overall speech of decision makers in each country, how important, how relevant is each of these terms. But now that's only an initial analysis, but what we eventually want to do is to actually look at the context of those themes. Because one thing is talking about masks, but another thing is about talking about how you talk about masks. So for example, we are finding examples here where there are, for example, a quote that I have in there, you have some quotes saying there are ways in which wearing a mask can be helpful, but that comes from Sweden. I think the message is really clear about the importance of using masks. That comes from New Zealand. So I think those the terminology that you use around the term mask, how strong it is going to explain as well differences in the strategy here. So we want to see how those things evolve. We want to see how that intensity of your recommendations, your advice is changing through the period that we are studying. So that's basically what we're doing at the moment. As I said, it's a project we only started in September. So we've been collecting data, we've been doing a lot of coding. There's a lot of interesting themes in there, but these are the things we're kind of looking at. So yeah, so that's basically all. I think I went a bit too short here, but anyway, if there's any questions.
Fantastic, and again, fascinating data. Thank you so much, Antonio. We have a question from Jer, who points out that, Jer, do you want to switch on your mic actually before I read it?
Jer, you should be able to speak there.
Jer, yes, yeah.
Great. Hi, Antonio. Really interesting. Thanks so much. I'm just wondering, within your data, can you elaborate on how you are measuring public health capacity? Thank you.
Yeah, public health capacity, what we're doing, I mean, we're using this article from The Lancet, and which gave us the idea, but we're going forward. We're going kind of more beyond that. But there was an article in The Lancet that we're using these or similar principles to these ones. So we are talking about your ability to trace, your ability to test, your ability to, so elements like that, anything. And then as well, we're looking at, kind of health capacity in general, like hospitals, beds, et cetera, et cetera. So we're kind of measuring all those elements there. That seems to be, but again, we want to be measuring the same ones across all the different countries.
Okay, thank you, Antonio.
Thanks, Antonio. We have a second question from Theo Bourgeron, who wants to know whether there's not a certain amount of, a very idealistic assumption behind the assumption that behind policy-making decisions of governments, there's differences in moral philosophy. And Theo wants to know about the role of businesses in lobbying governments, for instance, or, differences in governmental parties. And I can actually add my question to that, if I may. Differences in expertise as well that come in here, and obviously a one voice sort of a policy. We know in Ireland that there's rarely one voice behind those kinds of policies, and we've seen a couple of incidents where that became very clear. So what's the assumptions that you're making behind this moral philosophy argument?
Well, two things regarding the experts and how they engage with other. I think we have that area. We're coding this area of engagement with the community. So in there, we want to measure who you are engaging with to make your decisions, and what type of relationship you're establishing. So whether it's like you're consulting them. So for example, we already see differences in New Zealand is very, very stark. New Zealand, it's engaging in a very serious manner with different sectors, okay? In Ireland, the UK, we see a more, well, we'll talk to them, it's more about the future, or sometimes the consultation is not very strong. It doesn't seem the language, it doesn't indicate that it's very strong. So we're looking at that, and that's because that's a very interesting aspect. I think, how are you engaging your community? Not only citizens, but as well your experts and your hospitality sector, et cetera, businesses and all that. Then talk about the moral philosophy. I think here our assumption is more mainly about long-term, short-term moral assumptions. So I think there is an intuition here that the reason why Sweden hasn't gone down into a lockdown, and this is now an intuition we have. We're not 100% sure about this whatsoever, but might be that they're more taking this in an utilitarian manner, thinking that down the road, in 3 years' time, the numbers will be on their favor. Now, it's a risky strategy, obviously. And then the same thing, when people go into lockdown, the assumption is about, let's save lives right now, as soon as possible, as many as we can now, without maybe taking into account the future. So our analysis is going to be around that. We have, there are papers on morality, moral philosophy that use terminology. So we are working on a vocabulary that could actually, allow us to measure how utilitarian your language is, or how deontological your language is. So at the moment, we're only starting to look at this. So we're hoping that we'll find more things to dig in from here. So, but that's the initial idea, because we really believe, I mean, when we think about Sweden is a very competent country. How come that they are deviating so much from the rest of the world? So I think there might be something here that goes beyond the science. And that might be more about how you understand human lives and saving lives.
Thank you very much. We have a question from Colin. Colin, do you want to come in here live, or will I read out your question?
Well, yeah, I can see his question here. So I think that's interesting, and I think there would be
I'll just read it out. I think it takes quite a long time for people from the audience to switch on their mics. So Colin wants to know: have you considered that political parties might be a better indicator than moral philosophy? New Zealand, for instance, has a left-wing government. The Conservatives would have responded very differently.
I think that's a very interesting point. I think there would be some overlap as well. But even my intuition, that's a really interesting thing. We'll probably look at it. I think that's a really good, important point. But the way we understand moral philosophy, or utilitarianism and the ontology, I think sometimes you find within, let's say, left-leaning parties, people who have completely different moral approach from this way of understanding morality as the ontology or utilitarian. So we're looking more at about kind of meta-ethics more than the actual ethical, how you stand on abortion or anything like that. We're more talking about how you argue or how you build your moral argumentations here. But absolutely, I think there would be an really interesting thing to look at. What is the relationship between the two of them? And whether there is a difference as well in terms of, it's a left wing, or leaning left in New Zealand. Absolutely, yeah.
And I do remember on one of Andreas's slides, actually, the percentage of women in Parliament. So maybe female leadership could be another factor here. In terms
what we're finding is that the data is very rich. The data gives room for a lot of different, very interesting questions to look at.
Okay. Unfortunately, we're running out of time. Ilaria has another question for us in terms of the mix of, a lot of the time utilitarian and deontological approaches can't be sort of separated out neatly. So I'm just going to leave this with you as a comment, and perhaps Ilaria and yourself can catch up afterwards to discuss that. Thank you very, very much, Antonio.
Thank you.
So we're moving on swiftly to Darren Baker, who is going to talk to us about stepping into leadership, understanding the careers and leadership practices of women and men in precarious occupations in the UK, Ireland, and Australia. And obviously the issue of precarity has come, very much to the foreground in this pandemic. So I'm going right over to you, Darren, and thank you for your presentation.
Thanks, Susie. So I think you've touched on a really important point, Susie, there. I think whereas the other presentations today are looking explicitly at COVID or have emerged as a result of COVID, my project is one that started just before COVID and has hobbled its way through the pandemic to an extent. And so therefore COVID has now formed a new backdrop to the project and is colouring the data that I am collecting. And as you said, many of the workers I am interviewing are workers who have been, in inverted commas, at the front line of the pandemic. They're workers who will have been stacking the shelves in the supermarkets, delivery drivers, Uber drivers who continued on pretty much as is during the pandemic. They're workers who historically were seen as sort of, less prestigious workers, less important workers. And arguably they're workers that may well be impacted disproportionately as a result of any post-COVID political measures, such as austerity measures, even when they do occur. And so that's the sort of broader context. And I try and link bits of the presentation to COVID as and when I feel it's appropriate. But the first few slides just give you, just introduce the project, and then I've got a slide on some of the preliminary data or data patterns that are emerging from the data. So the project's on creamability and leadership, and the broader context is that we know little about the careers of men and women in precarious occupations. There is data at a macro level that traces very broadly the career trajectories of low paid or low skilled workers, but very little detail as to what are the reasons for those trajectories. And this is especially important from a gender perspective, because there is quantitative data to suggest that women are more likely to become trapped in precarious labour, especially after maternity leave or if they occupy part-time work. So from a social mobility perspective or career mobility perspective, I'm really interested in, why mobility increases or decreases or stagnates amongst these workers. What are the obstacles and enablers out of what you might consider to be in-work poverty or precarious work, low-paid work? But also as well, what are the attributes of those who are able to get out of precarious work? What do they express? What of the positive aspects of their journeys that we can learn from more broadly beyond just the sectors that I look at? And the project therefore focuses really on those obstacles and enablers to career advancement within precarious labour. And the objectives of the project are to provide insights into the reasons why careers become stagnant, advance, or indeed regress in these occupations. Particularly given reasons for the trajectories of women. Why do women become trapped in in precarious work? Thirdly, identifying those attributes across all levels of the sectors that I look at. And also trying to understand the role of class in the experiences of these workers. What enablers, what inhibitors are class related and which are not. And I actually compare a subsample of what we might consider to be prestigious or middle class precarious work. And obviously the project is across 3 geographies to give a sense of where, if class is at play in the experiences of these workers. And of course, as I mentioned at the start, this is in the broader context of COVID. So in terms of the participants, I'm obviously interviewing precarious workers, and I define these loosely as people on unstable contracts, poor pay, work with little prestige, dirty work you might call it in some respects, poor pensions and benefits, poor working conditions, and people who might occupy several positions as a way to make ends meet. The project or the participants are drawn primarily across gender. So men and women are the primary axis of comparison. But obviously class is hugely important category within this. And increasingly ethnicity. I don't look for a specific ethnicity, but I think by default of the nature of the work, it is disproportionately occupied by ethnic minorities. So there are 2 types of workers I'm interviewing: less successful workers, so those who after 5 years still find themselves in these precarious occupations. They've been unable to improve their pay, their conditions, or their seniority. And successful workers, those who after 5 years and beyond have been able to get out of precarious labour, perhaps move into better paid, more middle manager level positions. And so the sectors that I'm primarily recruiting from are hospitality and leisure, retail, and gig workers. And there is a small subsample of middle class occupations: media, education, and administration. And I don't include that subset in the figures that I will show you shortly. And in terms of just the background, I'm going to sort of go through this really quickly because I'm concerned about time. So obviously, COVID has been an inhibitor to the project itself. Workers are particularly time deficient in precarious labour. There's a lot of anxiety around. And obviously some of the gatekeepers that I would traditionally use, such as organizations and unions, have been less helpful because of the disarray and disorientation of the time. But one of the upsides is that I've become much more of an ethnographer, which has been fantastic. So actually just getting to know people in the community, which has been very rich for the data collection. So there are 2 interviews that I do with each person because it takes a psychoanalytical lens. And the key intellectual question is around how precarious workers manage internally the anxiety-laden aspects of their work. And overall, the hope is to recruit 100 participants. This is split equally by gender, and around 35% of them will be in the successful workers category, and then 65% in the less successful category. This is just some statistics as to where we are currently. Second year, we're back in Ireland to finish off the interviews there. And then in 2022, with my colleague at Bath University, I'll be doing the British or the UK part of the project. So in terms of emerging data patterns, so from a psychosocial perspective, class obviously is a really important component, and broadly speaking, the participants identify with the class. They identify themselves as either working class or middle class, but they often deny its importance to success. So even if they are occupying precarious labour, they don't see class as an inhibitor to their career progression. And often inequalities, or their inequalities, are constructed as a matter of choice or lifestyle choices. There is a prevalence of liberal discourses. Obviously a lot of the workers identify with certain diverse categories, such as gender and ethnicity, to articulate experiences of discrimination in the workplace. Gendered economic inequality. So there's an emerging pattern of older or more mature women in precarious labour who are particularly anxious about their future, sort of not owning their own house, the financial strain of private renting whilst using their pension. Gendered careers, so men who become successful are much greater risk takers, much more entrepreneurial than women who become successful. From the psychoanalytic perspective, less successful workers are less able to imagine their future. They want change, but they don't know how to do it. Shame. So shame is a prevalent emotion within the workplace. So there's a sense of hiding, particularly when there are difficult clients or difficult managers to deal with. And then dreams. So dreams form a really important way in which workers resolve issues or conflicts within the workplace, and identify so far 3 types of dreams or work dreams, nighttime dreams. And COVID obviously plays an important part in terms of there are workers who've taken on different work whilst they're on the full OR scheme, or they've been stood down from their sort of longer term jobs. There's a lot of anxiety around whether or not they'll return to those positions. Many feel trapped in their current role because they're unable to change roles because of the poor economic context. The challenges in implementing regulations within the workplace. A lot of workers find it really tough to ensure that customers are socially distant, that they're wearing face masks, but they also have to endure a lot of minor backlash by customers who question their use of masks and so forth in work. So in terms of next
1 minute left.
They're almost there. So next steps. So the hope is to apply for funding to complete the UK, the British and the Irish component. And there are a few options there that I'm hoping to explore. And then obviously at the end of the project, before I even go into any sort of academic paper writing, there'll be policy work. And I've been in conversation with Deloitte and a few other organisations who are interested in helping me put together a glossy paper to detail the sort of policy or practical aspects of outcomes of the research. And obviously workshops would follow that as well. I think that was just about on time. Just about.
Perfect, Darren, thank you so much. Really, really, again, super interesting presentation, going into sort of the more micro of what it feels like to be literally on the ground in this pandemic. Have we got any questions for Darren? I've got a couple actually, again, to kick us off while a lot of people are still thinking maybe. So two very simple questions actually. What you call successful precarious workers who get out of precarity, where do they go? Is it predominantly entrepreneurship? Is there a path within the organizations, and would that differ by sector? So where are the potential next steps? And then the second question I have, if I may, around this notion of shame, which I think is a very interesting one, and obviously I've followed Brené Brown's work very carefully on this. Has that shame, and you mentioned the implications of COVID, has that shame in any way maybe also diminished during COVID-19 because people realized just how reliant we are as a society on precarious workers?
Gosh, they're very interesting questions. In terms of the roots, my sense is those who are occupying sort of hospitality work, for them to become successful, often they will have to set up their own business, their own restaurants, their own coffee shops. So there are a lot of participants who have done that, and or maybe moved into sort of maybe more leisure related. So maybe some who've become quite successful gym operators. Oh, I think that's I don't know what's happened there. I was going to close my door.
Fire, hopefully not.
Apologies, it seems my alarm just seems to have gone off very helpfully during that. Yeah, so yeah, it's hard to say. Certainly those who are in retail, because they're much bigger organizations, those who become successful tend to become store managers or managers across certain regions. So there's a much greater sense of professionalization within the retail sector than in, say, for instance, the hospitality sector. And then the one around, I think you mentioned around shame, I think was the second question, Susie. Yes, I don't get the sense that they feel they're treated any differently than they have been in the past. I mean, my sense would be that they're finding it more difficult because customers are, questioning what they're doing. So the handling of cash, they have customers who come in and insist that they got to pay in cash and don't understand that they can't use cash, or customers who will continually question their use of masks, even if the customer doesn't have to wear one, for instance, in the restaurants in Australia don't have to do that, but they'll be questioned for that. So my sense is that nothing significantly has changed, although it would probably make quite an interesting question. Maybe it's something I could ask in the interviews. I think that'd be quite interesting.
And probably associated with that, Audrey wants to know, have you any sense at this point of geographic differences between, say, UK/Irish and Australian precarious workers?
Not yet, no. I think that would be really interesting, particularly in the British context where, class forms apparently a much more obvious sense of the culture. But of course, in Australia, a place where, they have a mantra of having a fair go, very much like the American, in that sense, class doesn't matter. Actually, class does matter in Australia. So it'd be interesting to see to what extent it does differ from the UK, but I can't say at this point, unfortunately.
Perfect. Darren, we'll let you switch off your alarm. Thank you so much. You're absolutely fine. Thank you so much for a really interesting presentation, and best of luck with the continuation of your work.
Thank you.
We're moving very swiftly through the program, and thank you everybody for keeping such wonderful time. We have one last but certainly not least presentation left by Alessia Paccianini, on testing the predictive accuracy of COVID-19 forecasts. And given that I've been fighting with my husband over that issue for the last 8 months, Alessia, I'm very much looking forward to your presentation. Over to you.
Thanks very much, Susie, for organizing this amazing event. Thanks for other speakers for all this fascinating presentation. I learned a lot about this topic. And in this project, which is a joint project with Laura Coroneo, Fabrizio Iacone, and Paolo Santos Monteiro from University York e Università degli Studi Milano, we are going to try to reply to a main research question about how we can compare different forecasts about the fatalities due to COVID-19. So, what is the main motivation of this research project? Sadly, we are used to watch news or read newspaper where there are a lot of figures about the COVID-19 fatalities, and in particular, there are a lot of projection. And all these projections are coming from different models with different assumptions. For this reason, we have a lot of heterogeneity in these all models. And we try to compare this model, and we try not only to say which is the best model, to try to understand how we can comment this result and if all these results are comparable or not. So how we do? We test the predictive accuracy of already done forecasts. So in this project, we don't forecast anything by ourselves, but we rely on already done forecasts for United States. And these forecasts are provided by the Centers for Disease Control and Prevention for United States. And this website is very nice because it's the public agency collecting all information, all statistics about COVID-19. And in particular, you can find a lot of projection. You can find a nice plot about this projection, and all forecasts are submitted by different teams. And almost all teams are related to excellent research center, for example, MIT, Columbia University, Johns Hopkins, and also from private forecasters. You can find on website the forecast at national level and for each state. And what is interesting also that this website is providing a combined forecast. So it's a combination of forecasts provided by other teams. And in this website, you can find also the Excel file about all these forecasts. And all these forecasts are at weekly frequency. So every week there is an update, and you can find the forecast for 4 steps ahead. I mean, from 1 week, 2 weeks, 4 weeks ahead. So we decided to use this data set because it is very well known and also is a public data set. And we try to apply a very important test in forecasting analysis, a textbook test, as we can define, the Dibble-Mariano test. But when we apply the basic Dibble-Mariano test version, we have some limitations. Because in this project, considering these data, we have a small sample. Because if you look at the website, you can find that these forecast teams started this submission around the mid of April. But to have a consistent number of continuous forecasts, we need to move our attention from the mid of May. So from the mid of May until the end of October, sorry, at the end of September, when we finish this project for the working paper, we had more or less 15 observations. And if we apply this test, Dibble-Mariano test, on 15 observations, there are a lot of bias. For this reason that we rely on a different version of Dibble-Mariano test. This version was proposed by my two co-authors, Laura Coroneo and Fabrizio Iacone, recently in a paper published on Journal Applied Econometrics. And this test is a modification taking into account fixed smoothing asymptotics to the Dibble-Mariano test. So there are some modification of a basic test. We decided to use this data set because we said before is very well known, is for free, and is data set very complete. If you look on website, you can find information not only about fatalities, but also about hospitalization, about cases. But in this project so far, we decided to focus on a number of deaths for several reasons. First of all, at least if we look at the first wave, the primary objective of health authorities was to minimize the number of deaths. Second, the number of deaths, unfortunately, is something that is not opinable in the sense that is not a noise variables. And instead, if we use, for example, cases, there are a lot of problems about asymptotic cases, which are not registered and also not detected. And also the number of hospitalization is a noisy value. And for this reason, that so far in this project, we focus on the number of fatalities. As I said before, in our sample, we look at the projection at a weekly frequency from 1 to 3, 4 step ahead. And we cover the period from the mid-May until the end of August, having the projection until almost the end of September. If you look at the website, you can find that there are a lot of forecasting teams providing these data. But we can say also that not all these teams are submitted the data in a continuous way. For this reason that we decided to focus on only 8 forecast teams. And these 8 forecast teams represented by team related to Columbia University, Johns Hopkins University, Los Alamos, MIT, Northeastern University, UCLA, University of Massachusetts, Amherst, and the last one is a private forecaster, Yu Wang Gu. All these models used for forecasting are different and almost are related to the epidemiological model, very well known nowadays, not only in epidemiology and but also in statistics and economics. But there are different assumptions in all these models. And for example, here in this table, I just report if there is a change assumption about social distancing related to the other papers presented today about the use of mask or not. And in this model, they consider different assumptions, different aspects about these elements. So what do we get in this exercise? If we compare the forecast reported by this team against a benchmark such as the quadratic model, and quadratic model is usually used in time series as a benchmark because is a good model to represent a continuous function, is a good approximation of a continuous function. We note how no forecasting team is able to outperform this simple benchmark. So it seems that at the short term, these models are not able to give us a good prediction. And this result is quite interesting because almost all these models with these all assumptions are more oriented to give better prediction at a longer horizon. And as we can see in our data, at a longer horizon, at 3-4 weeks ahead, forecasters are more successful and sometimes are able to outperform the quadratic model. Another interesting result is that if we look at the combined forecast, which is called in this website ensemble forecast, we note that this model is able to auto-predict the benchmark several times. So in this nice plot, we report the result of a test at different step ahead, 1, 2, 3, 4 step ahead for United States. And these horizontal band are the confidence interval at different statistical significance. And what we can see here are a result for different teams. And we report result using different loss function in our test. So just to give you the intuition, almost
1 minute left, Alessia.
Okay, I'm quite finished, thanks. we look at these loss function, which are for symmetric, asymmetric. And we see that these results suggest us that almost all models are not good at short term, but in the long term, almost we found some models, and especially the ensemble is good in forecasting. If we move at state level, look at New York, California, Florida, and Texas, we report a different result. In particular, we see if we look at Texas that no one models is good to forecast at the long horizon, is not able to beat the benchmark model. So our policy suggestion to health authority is that pay attention to use these forecasts, and in particular consider that these models could be very heterogeneous, and it's not good to use just one model, but you can rely, for example, to an ensemble forecast, which is a combined forecast, and also pay attention to use this model for different states. Connected to this working paper, there is also a website where we try to update our result continuously. So far, our website is static. We aim to have a dynamic website using a dashboard. And for this purpose, we enlarge our group, including 3 amazing data scientists, and to build up this dashboard. And our aim is just to help people consulting this website to see how we can change, for example, some features, change the interest variable, for example, use hospitalization numbers instead of fatalities, especially for the second wave. It could be more interesting, this aspect. And also you can change the kind of combined forecast. And of course, if you know that other countries are creating a similar website with a public data set, we are also aiming to use this other data set to enlarge our sample with different countries. So far, thanks very much for your attention, and thanks for staying here. I know that I'm what I am between you and the lunch in this moment. So most probably you are.
Perfect.
Yeah,
Thank you so much. Thanks, Alessia. We have a question from Maria Grishin. Alessia, have you looked at data from other reporting organizations outside of the US? I'm assuming other organizations will have less and perhaps less accurate data to work with when forecasting. So it may be interesting to look at how predictions work in limited data situations.
Yeah, thanks very much for this question, and I made the point that we use this data set because it's official, it's complete and reliable, but we are looking for other data set, and for example, we are looking for Italy, also for UK, where there are a lot of source, and we try to do the same, and most probably now we are going to increase our sample in this sense. Yes.
Yes. Are there any other questions for Alessia?
No, not yet.
No,
you can send me an email.
Exactly. So again, please feel free to send emails to any presenters for today. Julie, I know you've been eager to come back in to present someone, to introduce someone to us. So Julie, I'll hand over to you very quickly.
Thank you, Susie. Thank you. No, I just wanted to introduce my co-author, Lauren, who is joining us from Kansas. So she is quite far away, and it is very early in the morning. But Lauren is a assistant professor of marketing at the University of Kansas. So thank you so much, Lauren, for being here as well. So the project I presented is joint work with both of us. So if you have any questions, feel free to email us both.
Thank you so much for getting up so early, Lauren. I think your entire nation hasn't got a lot of sleep in the last 3 days, so it is very much appreciated. So this wraps up our first COVID-19 research morning, and again, I think the morning speaks for itself in terms of just the quality, the diverse subjects, and very topical issues that researchers within our business school are engaged in. I want to thank CeBaS, the Centre for Business and Society, and my own MISFIRES project team for helping me organize this event. I'm very much looking forward to the second installment, which is in a couple of weeks, 3 weeks to be precise, on the 27th of November. And I really hope to see many, if not all of you there again. Have a lovely weekend, and thank you so much. And again, I'm just overwhelmed by just the relevance of the research that we're doing collectively. So thank you all.
Thank you very much.